Well, I'm going to talk about alcoholic beverages and increasing the tax on alcohol as a public health intervention. So first, we all know we've got a serious problem, right? 80,000 deaths per year attributable to alcoholic beverage consumption in the US, 1.6 million hospitalizations per year, over 4 million emergency department visits per year, over $200 billion in healthcare and other social costs, which works out to be about $1.90 a drink. That means that the consumer purchasing an alcoholic beverage does not pay almost $2 of the external cost. That's a subsidy on the consumer of alcohol and a subsidy to the industry that produces this product and sells it. Well, what's the problem? The policy problem is that most alcohol-specific taxes are ad valorem tax. They are a set tax. They're like 25 cents a gallon. So if the tax is 25 cents a gallon of booze, the problem, a key problem, is that every year that there's inflation, that tax goes down by the inflation rate. Many of the tax rates have not been adjusted or have been only adjusted a little bit every once in a while. So we're in a situation now that the real alcohol tax rates are less than half of what they were just a couple of decades ago. That's the problem. They've not kept up with inflation. I mean, just think of it. If you take it from the 1950s, there's another paper being presented right at this conference later this week that looked at this from the 50s forward. Spirits now only cost 1/5 of what they did in the 1950s. And yet at the same time, mean incomes are up in real dollars about 3 times. So it's a tremendous, the degree to which alcoholic beverages have become so incredibly inexpensive, so different than just a few decades ago, is something that people don't quite realize. So what's the legal intervention? Double the current rates and build in automatic adjustments for inflation. Every year, whatever the inflation rate is, the tax goes up by that inflation rate, so it holds constant in real terms. What's the strength of the evidence? Well, this is evidence-based public health practice, folks. There are hundreds of studies that have looked at the effects of alcohol taxes, that have looked at the effects of alcohol prices. Alcohol, like anything, responds to price. When it's more expensive, people buy less. When they buy less, they drink a little less. When they drink a little less, they have fewer, on average, of the whole litany of public health problems. That's been documented. It's in multiple meta-analyses, systematic reviews. CDC has done these things. They are all out there. The evidence is overwhelming that this is an effective intervention in reducing the public health burdens from alcohol consumption. Well, what's the feasibility issue? Well, this should be easy, right? The easy part is every state, the national government, all over, we're starved for public resources. The budgets are tight, revenues are low, and here's a tax that's not been adjusted. We're just going back to the good old days in the 50s would mean very dramatic changes. Most proposals are just going back to what they were in the 70s or the 80s or the 90s, an increase in the taxes. So the revenue push is there. The evidence is overwhelming that this is effective in reducing morbidity, mortality, injuries, homicide, suicide, car crashes, cirrhosis, cancers, throat cancers. The list goes on and on. The evidence is overwhelming and the need for revenues is there. What do we have? We got one source of opposition, and that's the people that sell it. And they fight tooth and nail against any tax increase because they know it's effective. But that can be overcome. We had the same thing with tobacco taxes, and we've overcome that. We can do it with alcohol taxes. It's something that's easy to do. The field of public health should take the lead, and we should broaden this and put this in place so we have a permanent solution, permanently indexing these taxes to inflation, so we're not back with this problem again in another few years. Thank you.